Dr. John Fortin, MD. I'm a physician at Eye Center South. Well, what's happening in this country and around the world, the population is aging more and we have more and more people that with aging have a disease we call the macular degeneration that's causing progressive blindness or with the advance of new technology, we've been able to save a vision on many patients. And I do multiple injections in the eyes with new drugs to try to save their vision over time. When we talk about macular degeneration, there's two kinds. You have the dry type, which is a progressive, relentless, atrophy or degeneration of the center of vision we call the macula. And up to now, not much we can do about it except prescribing a vitamin supplement. But there is the worst kind, because the wet macula, when they start to develop blood vessel growing under the center of vision and causing bleeding and swelling and loss of their central vision, impairing their capacity to read or drive a car. And up to about 15 years ago, the only treatment we have was doing some laser to cauterize the leak, at the same time causing a blind spot at the back of the eye. They were trading a problem for another one. If I examine a patient and the macula is pristine, although they're 75 years of age, the odds of developing a macular degeneration is very poor. But if I can see early change on their macula, I will let them know that there is a risk on the long run to have progression. And the first thing to do is to recommend them to use a vitamin supplement. There is a special formula that has been shown to prevent disease progression, but it's not a proof that is not going to stop the disease progression, but will help to stabilize their vision. As for the patients who developed the active disease, that's a different problem, because oftentimes they will need an injection once a month for several months. But since the advent of those injections we call anti-VEGF drug, they simply stop the vessel to grow and leak in the back of the eye. We make those injections on a regular basis. It's not a cure for the disease, but we try to control and prevent progression of their disease and try to keep the macula dry.